What's up, friends? Rob here, the Medicare Minister with Agape Insurance and Financial Group. And today I'm with Mr. Matt Gaines from the Advanced Diabetes Supply Group. Matt, will you say what's up to everybody real quickly?
How you doing, everybody? Thanks for watching today.
Absolutely. So if you are a diabetic who's going on Medicare, or maybe you're currently on Medicare and you're a diabetic and you've been having some challenges with your supplies, with your insulin, then you definitely want to watch this entire video because Matt is going to give you some serious value today, give you some tips, and we're going to dive deep into how you can get the best possible situation if you're a diabetic, you need those supplies, and if you're taking certain insulins. And the Advanced Diabetes Supply Group with Mr. Matt here is one of our premier relationships that we have, and we're so blessed to be connected with them because they help many of our clients make sure that they get taken care of. So, Matt, real quickly, we just give us a bio about the company you work for, what you guys specialize in, and then maybe give us a little quick intro into how you can help those that are diabetics and on Medicare.
Of course. So thank you again for inviting me here today. I'm very appreciative to be on here with you. So Advanced Diabetes Supply is a diabetes specialized pharmacy. Our main focus is helping people on Medicare get the supplies they need to manage their diabetes for basically all of their hardware, whether it's standard testing supplies with blood glucose monitors, continuous glucose monitors like the Freestyle Libre and Dexcom, or even as far as insulin pumps and reoccurring supplies that they'll need as well. A lot of these hardware supplies are very difficult to get at the local pharmacy. Pharmacies are really good for billing drugs. They're really good at medications. That's what their bread and butter is. But when it comes to hardware, they don't always have the ability or the experience to make sure it gets billed properly. And that's where people end up paying out of pocket for things that should be covered. So what we do is we work directly with insurance agents. We support them and their clients to make sure that they are getting the top-notch service to ensure that no matter what supplies they need, if they come out of pocket for anything, it's the absolute lowest amount possible. We are experts in the field. We've been working with diabetes-only supplies for over 20 years, and we've been supporting specifically Medicare members for about 14 years. So we have a ton of experience, and we're here to make sure that everything gets billed properly and that, people are getting the maximum amount of coverage that they should be able to get through their plans.
Yeah, and I definitely love that you brought up the point that like pharmacies, this is their bread and butter, this is what they specialize in, but they don't necessarily specialize in the supplies. Just for the sake of the audience, because most people that are watching this channel are either going on Medicare or they're on Medicare already and they're just trying to get some Medicare information. Can you give us a scenario in that, like what that looks like? Because I know that it may not be at no cost for everyone, but could you give us a situation maybe where they were paying for something, but then technically they shouldn't have been paying for something, or they should have been paying a lower cost for those supplies?
Exactly. I actually just had a conversation like this yesterday where I was speaking with a client, and what happened was she was getting the approved brand. So a lot of the Medicare Advantage plans are going to have 1 to 2 brands specifically that will be covered in full for standard blood glucose testing supplies. So a meter, the test strips, and the Lancets. So typically that's your choice. When you're going on an MA plan, you're going to be looking at 1 to 2 brands that should be fully covered for you. I was speaking with a lady where she was using the approved brand, but for some reason, the pharmacy was billing her $44 a month for her test strips. Okay. Those are included in diabetes testing supplies and should be covered in full. But it seems that the pharmacy was not able to bill it for some reason. A lot of these supplies, some are drug items, but most of them are considered DME, which is durable medical equipment. And that's a benefit of the Part B side of Medicare. So those two suppliers, a pharmacy and a DME supplier, are much different. So it's really hard for people a lot of times to get these supplies. And, a lot of people don't even know that they have a problem necessarily. They think that paying for their supplies is totally normal without even knowing that should be covered in full. I had another situation about last week. They were using the Freestyle Libre, which is a continuous glucose monitor. The sensor that someone would wear on their body that continuously reads their glucose levels throughout the day, so they don't have to prick their fingers anymore, and they can test as many times as they want. Medicare does cover these units. They are quite expensive. And the lady I was speaking to was told by her local pharmacy that Medicare does not cover these, when in fact they do. They definitely do. As long as she meets the requirements to get coverage for it, they should cover it in full with the plan she had. So I was able to help her out and save her about $85 a month that she was paying for those supplies when she has them fully covered.
Yeah, and I love that you bring some of those points up. And real quickly, for those that may not know some of the Medicare lingo, what Matt's talking about when he says MA plan, or we say MAPD, that is a Medicare Advantage prescription drug plan, or a Part C plan. So this is what we're talking about. But I also love the fact that you bring up that there's a lot of Medicare beneficiaries that were never advised or educated on the difference of billing under Part B, B as in boy, for your medical, right, versus your Part D. And folks, if you're watching this today, you need to know the differences between those, because it could cost you a lot more for no reason, especially if you don't have someone even at the pharmacy that knows the difference, or whatever agency you may be dealing with. It could wind up costing you hundreds of dollars more every year. And this is where working with people like Agape and us working with Matt can save you quite a bit of money. So I'm glad that you bring that up. And Matt, we had a client recently that we turned over to you that, like you said, they were used to paying this amount of money. I don't remember how much it was, but it was quite a bit for their diabetic supplies. And you were able to come in there and cut that cost significantly. I met with them about a week or two later, and they were so thankful that I connected you guys, because it was just normal to them to pay that type of money. And I'm sure you see that all across the country every single week, every single day, probably.
Yeah, I see it a lot, and it's a really common issue. The local pharmacies just really have trouble with those hardware supplies. So that's exactly what we're here for. We don't do anything else. We only deal with diabetes supplies, and that's all we've been doing. So we figured, let's pick one thing and let's do that really well. And it's great that we get to help so many people, because once again, a lot of people don't even know there's a problem. And then a ton of people on Medicare are either retired, only getting Social Security as their income. Yep. Things get tight a lot of times. So it's really nice to be able to cut any corners you can and save a few bucks every month.
Yeah, and I definitely love that you're bringing that up as well. So let me talk about this for those that are watching, because we're talking about Medicare Advantage. Does it work a little bit differently? Because what if somebody's watching today and they're on original Medicare with a supplement and a prescription drug plan? Are there some differences between the Part C or Medicare Advantage side and the original Medicare side with a supplement?
There are definitely. So there's a lot of pharmacies that can't necessarily bill direct Medicare plans and only work with Medicare Advantage plans, or vice versa. And then there's some different coverages in those as well. So it really depends. Does somebody have a supplement like a Plan G or a Plan F, or do they have a prescription drug plan? That's really going to help them cut those costs. I know they have a monthly premium, but when it comes to going and getting those supplies, that's what ensures that you're going to have the coverage available for you to save the most money as picking up and receiving your supplies. So an original Medicare plan for things like diabetes testing supplies, continuous glucose monitors, and insulin pumps, those are all still going to fall under Part B. And the reason why a supplement is so important is Medicare does not cover the entire cost of these supplies. It leaves a copay every time, and that's the way Medicare is. So having a supplement is going to pick up those remaining Part B copays for you, and you'll be getting your supplies easy, out the door, no cost.
Gotcha. And listen, I'm going to pause right there. And if you're getting value out of this video today, will you please take a moment to like, comment, subscribe? This just helps us help more Medicare beneficiaries like yourself. So Matt, let me ask you this too, because people, may have a cost associated with supplies, or maybe they just don't know what they don't know. Don't you see them not getting the testing equipment that they need? Or like in my space, I get some people go, I'm supposed to take this medicine, but I haven't taken it in 3 years because I can't afford it. I'm sure
No,
you
yeah,
see the same thing when these people that you're dealing with on these supplies that they just can't afford it. But then you come in
yeah.
and go, you should have been getting this all along, maybe for at no cost or for a relatively low cost, right? You're seeing that quite frequently as well.
I have, and that's really scary because that's dipping into different waters there. And I've spoken to people that are supposed to be testing their glucose level 3 to 4 times a day, and they're not
Mm-hmm.
testing at all because the test strips, especially when you get up towards 3 or 4 times a day, you're using a lot of test strips throughout the month. And if the pharmacy is not billing those to the plan and they're paying out of pocket, that's going to
Yeah.
be really expensive. Or people that really just don't like to prick their fingers. I've talked to many people. Oh, my doctor wants me to test, 1 to 2 times a day, but I don't like pricking my fingers, so I don't. The other hand, people on insulin, which can really be a problem. If you're not testing, if you don't know what your glucose levels are, you don't accurately know how much insulin to inject. And too much could be a problem. Too little could also be a problem. So it's really important that you're testing your glucose levels. You're making sure your blood sugar's in a comfortable and healthy place, especially before taking any medication. And that's a real big problem. That's what we're hopefully here to help with. We want to help as many people as possible get the things they need so they can manage their diabetes comfortably without
Yep.
having to spend an arm and a leg to do so.
Yeah, and I definitely love that about your guys' mission. And like I said, we've worked together in different organizations, and man, what you guys do is awesome. And to see the people so excited to be able to get that testing equipment they need, especially up to date equipment, right? That it's up to date.
Yep.
It's the newest stuff in a lot of cases where they can get more accurate readings. And we deal a lot with a lot of people that just can't afford very much. So those testing strips and anything else that comes out of pocket, sometimes it's the difference between paying the light bill and testing, my insulin and checking my sugar. Checking my sugar level. And a lot of times they choose the light bill,
Mm-hmm.
right? Or
Yeah.
groceries versus testing my blood sugar level. And it's like groceries, and rightfully so, right? You got to eat, you got to have lights and utilities. So I definitely love the fact that you guys are helping people get that at the lowest possible cost as possible. One thing that really triggered this interview, and I wanted to get you to come on the channel, was because of some of the emails you had been sending out, because a lot of people are not aware of the various insulins that are covered in this Inflation Reduction Act or Insulin Savings Program. One
Mm-hmm.
of the things that I love that you brought out in those emails that you sent out was the fact that a lot of Medicare beneficiaries don't realize that maybe they're on insulin A that's not covered. They didn't know that, right? When they could even go to like insulin B that works the exact same way, that
Mm-hmm.
is covered in in that formulary, and that program brings it down to $35 per month. Can
Yeah.
you talk a little bit about that?
Yeah, definitely. And that's a great thing to bring up because I had a conversation with somebody not long ago where she was paying over $1,000 a month for her
Wow.
insulin. So what happens is there's an insulin savings program, and what that does is it caps insulin at $35 a month for people on Medicare. The caveat is each carrier has a specific type of
Yep.
insulin on formulary that is the only ones available for that $35 a month. If you get one that's not on formulary with that plan, then you're gonna end up paying the full cost price of that insulin, which can be upwards of $500 for a 30-day supply. It's really, really important to be paying attention to that. And if you are paying a ton of money for your insulin, get with your insurance agent, get with your doctor, and see if you can get yourself onto an alternative insulin that is on that formulary. That's so important because that's the only way you're going to get that at $35. And there's no way they can charge you more for it. There's no way they can charge you less. It's going to be consistent, and you know how much that's going to cost you for your 30-day supply. That even
Uh,
falls into people on insulin pumps. So another thing that is a little bit tricky, especially with pharmacies, if you're on an insulin pump, your insulin falls under Part B. It is no longer going to be a drug item at that
Good
point
point.
and would
Yeah.
have to be provided by a DME provider. So there is a little bit less restriction there. There is no brand restriction, so they can go with whichever type of insulin their doctor's requesting. But starting January or July 1st of this this year that just passed, that is also capped at $35 as well. So if you're paying more for your insulin, and that's like daily injectable insulin like Lantus, Humalog, Novolog, those are going to be capped at $35. There are some injectables that are not capped at $35. There's anti-diabetes medications like Ozempic, Jardiance, Mounjaro, Trulicity. A lot of people believe those to be insulins, but they're an anti-diabetes medication and will not fall under that $35 cap. So make sure that you know which ones are on your formulary and which ones your insurance are going to help you out with.
Yeah, so let's talk about that real quickly. Like when you're saying anti-diabetes medicine versus, regular, like an insulin, like the Humalog, Novolog. Can you expound on that just a little bit more for maybe those that are watching today so they understand what that means?
Yeah, there's a lot of buzz going around about around for Ozempic right now. So it's a
Yep.
once a week injectable, and
Right.
its goal is it's a peptide that is its goal is to lower your A1C, keep your glucose levels lower, and depress the appetite as well. I've heard great things from it. A lot of people are using it. It is typically an anti-diabetes medication. So it's a medication that's prescribed to people with diabetes to help keep their glucose levels in order and in a healthy range. An insulin is a replacement of the insulin that our body creates. So they're very different. The Ozempic is a once a week shot where your insulin, you're going to inject either once a day, 2, 3, 4 times a day, however much your doctor thinks you need it. But there is a big distinction there. I've had a lot of conversations with people thinking they're on insulin, but they
Yeah.
are actually on an anti-diabetes medication. So it's a little upsetting when they find out they can't get the $35 insulin
Yep.
savings program, but it's a really, really good thing to know the difference of.
Yeah, no, I really wanted you to expand on that because I can't almost every week here with people that we are, working with, our current clients or people that are wanting us to help them get on Medicare or review their Medicare. I just had a lady from over in Alabama basically say she can't even get her Ozempic and she's a diabetic and is supposed to be taking it, but because it's such a fad now to be on Ozempic for weight loss and everybody's, getting on Mounjaro and Wegovy and all these other big name drugs that they can't even get it. And
Yeah.
so that's why I wanted you to bring it up to talk about the difference between that. And by the way, we will have a list of those the complete insulin list for you down in the video description. And also, this is why it's important that you get with seasoned Medicare advisors like us at Agape. I'll just put the number on the screen here. And we would love to be able to review that for you at no cost or no obligation. I'll also have Matt's information in the video description. Reach out to him and see what him and his company can do for you. And all I ask is please let them know that Agape told you, that they pointed you that direction. But this is why it's important that you work with people that know what they're doing, because it could literally cost you hundreds of dollars or more every single year. Because you just don't know what you don't know. And this is where getting with professionals and dissecting this and finding out the best options for you is very, very important. Well, as we get ready to wrap up here in just a few minutes, Matt, what are some other things or some other tips or some other advice that you could give to Medicare beneficiaries when it comes to navigating this whole insulin and diabetic supplies?
It's really difficult for a lot of people. What I really recommend is to really, if you're on medications, if you're paying for medications, make sure they're on formulary and you're getting the
Yeah.
maximum amount of coverage as possible. For any of the hardware that you need, I know a lot of people are wanting a continuous glucose monitor. So that's kind of what I really want to highlight on, because we deal with a bunch of those and we help so many people get them that did not know they can. So Medicare does have requirements. If you're on insulin or you're experiencing hypoglycemic events, which are low glucose level events, and you've been working with your doctor on those, that qualifies you to get coverage for a continuous glucose monitor. Regular Medicare and MedSup plans cover those. Medicare covers it 80%, and the MedSup should cover it 20%. And then every single Medicare Advantage plan also offers coverage, and they have to follow the same requirements by Medicare to be on insulin or having the hypoglycemic events, but every carrier does have coverage for it through the preferred provider, and it's at least 80%. So in the 20% coinsurance rate, it makes it a lot more affordable a month for people to get these. We do also have programs where if copays are difficult to pay, if you qualify, we can help waive those copays if we can.
Okay.
We have other additional benefits for people that are needing help, such as if they need testing supplies and we don't yet have a prescription for them, we will get them a sample kit out, a brand new meter, brand new test strips, brand new Lancet. So if there's anything you're having trouble with, any questions you have, speak with an expert on that. If it's about your plan, speak with Agape. If it's about diabetes, reach out to me, definitely. We're always happy to help. And even if it's just using us for a resource of information, we want to make sure people are getting those help.
Yeah, and I definitely love that, because what we're saying is this is at no cost or no obligation to you. Like, take the initiative to reach out, because you never know. It could make a huge difference in your budget today. So I definitely love that you're bringing this up. So let's, as we get ready to close today, let's give them a scenario. Let's say I'm on a Medicare Advantage plan. I'm hearing this video for the first time. I'm going, I may be paying too much. Like, I don't know what I have, or I don't have the latest monitoring equipment, or I'm not checking this because of budget concerns. They simply pick up the phone, they call you. What does that process look like? Because as you well know, there's a lot of people out there that are scared to deal with people outside of their local area there. But can you just kind of give us a step-by-step, or as much as you can, of that process and how that looks?
Yeah, and I'm glad you bring that up, because I almost forgot my favorite part is our service is at no cost to an insurance agent. It's at no cost to the client. We're a pharmacy and a DME provider, so we make all of our money billing the insurance. So it is risk-free. We're not going to have to charge you anything, and we go through that process really well. So what happens is, if you reach out to me, tell me Rob sent you, we'll go ahead and get you started with an intake specialist. That's where they'll gather the information so they can set up your file. And then that way we can start pursuing the prescription from your doctor. We'll reach out to them. We'll send them a fax with the form we need filled out. Once they send that back, all we need to do from there is verify insurance. Some supplies will require a prior authorization. That's just basically us having to prove medical necessity to the insurance company that you need this item. And if it is medically necessary and the insurance company agrees with that, that's how we're going to be able to get coverage for you. At that point, we'll give you another call. We'll review your insurance verification step by step, let you know how and what everything is covered, and make sure that you're okay with that prior to us getting it shipped out. We need verbal confirmation to ship any supplies out, so we need to make sure that you're comfortable with that. And then we'll get it sent and delivered directly to your home within 3 days, with no cost shipping as well. And then we'll give you a call about a week ahead of time and get your refill started.
Yeah, and like I said, one of the reasons I wanted to have you on is because you guys have been a great resource for us, and everybody we've referred to you guys has been pleasantly, just really pleased, with everything, the service, the way you guys from start to finish have treated them. And obviously most of all, the savings, the savings, and them being able to get the supplies that they thought that it was just normal to pay this amount for it. They had no idea. And that's not knocking anybody else. It's just the fact that, like you said, I sound like a broken record, but you just don't know what you don't know. And I can't stress this. This is why you want to work with seasoned advisors and professionals that specialize in these things, because as most people, as you talked about earlier, most of the demographic that we're dealing with on a very limited income. And those pennies, those dollars, those nickels and quarters, they really, really matter. Well, as we finish up today, what anything else that you just want to share with the audience that you think would be beneficial to them as they're beginning to either navigate this Medicare journey, or maybe they've been on Medicare for a while and they just didn't know this information?
Yeah, so kind of what we mentioned earlier is certain Medicare Advantage plans are going to have certain brands on formulary. So when you're looking at getting put on that plan, if you have a brand in mind that you prefer to use, say you really like using one-touch testing supplies, that's
Yeah.
great. You want to make sure that the plan you're going on is going to have that available because, as I said earlier, there is only about 1 to 2 different brands that most carriers have available to get full coverage. Aside from that, you're likely going to be charged the full amount. And then,
And
as Rob said, really honing in on that, reach out to experts. Ask for the help that you need to make sure that you fully understand uh, what you're signing up for. Medicare itself is extremely complicated. That's why
yep,
people need to be licensed and study Medicare for a long time to fully understand it. Diabetes is also really complicated, and
it is.
billing those supplies to the plan is also really complicated. So feel free to lean on the experts and lean on the resources that you have available to make sure that you're saving every penny possible, because that's what we want to help with too. That's my favorite thing about this job is I don't have to sell anything. Our service doesn't cost anything. I just get to help people all the
Yep.
time. I don't ever have to ask for a credit card number. We want to help save you money, and we want to do this by just using what your insurance already has in place.
No, and I definitely love that is the fact of just the heart to help people. And listen, folks, I'm a Medicare advisor. I study this every year, but I'm still connected with experts like Matt because this whole diabetes thing can be really overwhelming and really complicated. And so
It
that
can.
it's great to have partnerships like Matt to be able to lean into that and send people that way and then watch them, get blessed and be able to get the equipment, the supplies, strips, that they need. Well, Matt, I thank you for taking a few minutes today to come on the channel. I know you're really, really busy. And folks, if you're watching today, I pray you got value out of this. And please reach out to the number on the screen if you need help with Medicare, if you need help navigating the formularies and making sure that you're on the right plan. Once again, this is no cost, no obligation to you. Or if you feel like you're on the best plan and you don't need help there, or you got a local agent wherever you're at, reach out to Matt and let him help you. His information will be in the video description. And I definitely know it would, just a few minutes on the phone with Matt or myself could make all the difference in the world. So Matt, thanks for coming on today, man. And thank you for providing so much value in a short amount of time. And we're so thankful for our relationship with you guys.
Right on. Thank you, Rob. I really do appreciate working with you and the opportunity to be on here with you today. Very excited to help. So thank you again. I really do appreciate it.
All right. Well, God bless you guys. Thank you for watching, and we'll see you on the next video.